Hi there, I'm Helen Birch, your guide to sexual empowerment and confidence in the bedroom. So, if you've been struggling to find your rhythm, your confidence, or even just to last a little longer, then you're in the right place today. So, we will be discussing the average duration of sex, the nuances of premature ejaculation, and also explore some various treatment options. So today we are delving deeper into understanding premature ejaculation and how to address it effectively. So what's the deal with premature ejaculation? We're going to break it down a little bit. Studies suggest that around 30% of men face challenges with premature ejaculation, yet only 9% seek professional advice. It's time to change that narrative. So, on the average duration of sex, so that is basically the average time that someone takes from the beginning of vaginal or penetration to its end. That is about 5 to 7 minutes. So, 5 to 7 minutes is the So, what is the average duration of sex? So, we talk about the average time as being the time that it takes from someone entering penetration to having an orgasm, and that is roughly about 5 to 7 minutes. So, that is the average. So, if you're comfortable with that, then you are totally fine. However, when you look at surveys where they ask people how long they want sex to last, it's anywhere between 13 to 17 minutes. So we're going to talk about how to deal with something called premature ejaculation, which will essentially help you last longer in bed. So premature ejaculation is not just about duration, it's about understanding your body's responses and finding solutions that work for you and your partner. So you do not need to do anything or change anything you're doing if you are happy and comfortable with it. Also talk to your partner about what they want in the situation and what they would like out of sex. Maybe it's not just penetrative sex they want, maybe you could do more oral, more manual, bring in some sex toys into the bedroom with you. So really make sure that you talk to them and find other ways that may be equally pleasurable or even more pleasurable than having longer and longer penetrative sex. So how do we define premature ejaculation? So there are really three major components to it. So one is that having an orgasm or ejaculation within 1 to 2 minutes of intercourse. Number two is the inability to delay ejaculation in nearly all sexual encounters, whether it be with a partner or with yourself. And number three is that it is causing some negative personal consequences like stress, anxiety, those sort of things. That are actually causing you distress. And if all these three things happen, then this is called premature ejaculation, meaning that you've probably had this problem your entire life. Sometimes people can get what's called secondary or acquired premature ejaculation, and that's when you previously had normal ejaculatory function, and you had a normal duration of sex, and then all of a sudden you start developing a shortened time to ejaculation, usually less than 3 minutes after penetration. While there's evidence to suggest that it's due to abnormal transmission of chemical messengers in the brain called serotonin, when people have premature ejaculation, they have receptors that respond to serotonin that happen to inhibit ejaculation or stop ejaculation from happening. And these receptors don't work as well as they should be. So that could be a biological reason why you may be suffering from premature ejaculation. But it's also kind of important to understand how ejaculation works. So, ejaculation is a reflex, meaning that your body automatically ejects semen, which is in response to certain things. So, in this case, it's usually friction, as well as how your brain is perceiving that friction to feel, i.e., pleasurable. So this reflex is organised by an area called the spinal, which is where the ejaculation centre is, which is kind of located in the spinal cord. So when you have these stimulations, it sends a signal up to the spinal ejaculatory centre, which takes the pulse of all the other information from your brain as to what you're thinking about the situation. It triggers, and then it triggers that ejaculatory reflex. So I just want to debunk a common myth, something I love to do. So there is no one size fits all when it comes to sexual satisfaction. Communication with your partner is key, so really understand what brings pleasure for each other and explore this together. Now let's talk about the tools at your disposal. From therapy to the stop-start method to sprays, there are a range of options available. So it's about finding out what resonates with you. But the number one thing, and one of the most successful things, is therapy or sex therapy. And the reason for this is that things like depression, stress, anxiety, guilt, shame can all impact the time to ejaculation. So it's important to take into consideration how your mind is perceiving sexual activity, and how your mind is perceiving sexual activity with a partner. Fixing these issues with the help of a sex therapist can be extremely helpful. The next treatment option is something called the stop-start method, something you can do at home. And this is when you are getting close to ejaculation, you or your partner squeezes your penis until the erection partly goes away. You can do this about 3 times until you finally allow yourself to ejaculate. Do this continuously for 3 times a week until you see that you have increased the time to ejaculate. Sometimes seeing a pelvic floor doctor or working on your pelvic floor in addition to this is also really useful, and these are treatments that you can do at home or with your partner, which can help strengthen those muscles in the pelvic area, so that you can have more potential control over ejaculation. Okay, so one other method is to use topical anaesthetics, and basically whether it be a spray or a cream, they work by reducing sensitivity, allowing you to prolong intimacy with some sacrificing of sensation. So what it does is it is a numbing agent that you put on the penis, and it actually diminishes the sensitivity of the glands in the penis, so that you're getting less sensory information from the penis to the spinal ejaculatory centre, hence stopping that reflex happening. So you can use these topical anaesthetics up to 5 minutes before sex. However, you need to be aware that if you are going to have oral sex, then you will need to wash your area before your partner begins oral sex, because if not, there is a risk of that product being transferred, and also that means that your partner is going to get that numbness as well. That also needs to be something that you are aware of, that numbness sensation could also be passed on to your partner when you are having sex. So it may be something that you don't find compatible with each other. But again, just keep that communication open, give it a try, and then just talk about how it felt afterwards. On to another option that is out there, which is antidepressant medication. And so you may be wondering exactly why antidepressant medication works for premature ejaculation, but it works because it works on the serotonin, preventing that uptake of serotonin. So there is more of it around to work on those receptors that maybe are not responding as well, so that you can get more of a delay before ejaculation. And certain antidepressants, usually called selective serotonin reuptake inhibitors or SSRIs, are only prescribed by the doctor. So you definitely need to make sure that you speak to your doctor about this and explain that you would like to use it for premature ejaculation, because obviously antidepressants are not actually supposed to be used for premature ejaculation, but one of the side effects is delaying ejaculation typically. So if you take it daily, then you will need about 5 to 10 days after starting the treatment before you notice a difference. And that may continue to improve for up to 2 or 3 weeks after you start that treatment. And usually the doctor will start you on a low dose, and then you can work your way up to get the right effect that you require. But there are side effects to this, including fatigue, having nausea, also diarrhea, increased sweating, and also a common side effect is that some people notice a decrease in libido and sex drive, which is obviously not desired if you're trying to treat premature ejaculation. And sometimes people also notice that their erections are not as hard as they were. But again, this is just an option and something that you should go speak to your doctor or medical professional about. Taking the next step. So if you are ready to reclaim your confidence and unlock your full potential in the bedroom, then I do invite you to join me in my sexual mastery program. In this program, we dive deep into techniques, strategies, and mindset shifts that will transform your intimate experiences, gain confidence, and also overcome premature ejaculation and any other sexual dysfunctions that you may be suffering. So again, I will leave that link in the description box below. So just click on that link to learn more and embark on that transformative journey with me with those proven steps and techniques. That is all for now. I hope you have a much clearer understanding of what premature ejaculation is and have been given some food for thought on various treatments that will help with your premature ejaculation or getting that control back over your orgasms. That's all for now. Thank you very much for watching. Take care for now. Bye bye.